Hello and welcome to another podcast of Beyond the Arches. I'm your host, Dr. Daniel Northuck, and with me today we are blessed with the presence of Lilia.
Hello.
Lilia is our treatment coordinator who we've talked to before, and we have a special guest announcement, introduction, Blake Hauer.
What's going on, everybody?
Soon
Welcome.
to be the new surgeon on the street at the Boca location, and so we're very excited to announce and bring him on and have sort of a meet and greet conversation and an episode where we discuss sort of who you are, where you come from, your background, that kind of thing. And so, welcome to the room, if you will.
Thanks, Dan. Yeah, happy to be here. I'm really happy me and Dan, we crossed paths and we're going to be together working in Boca. And a little bit about me, if we can go into that to start.
Yeah, let's talk about where you went to school, and then we'll talk about why you went to school and how excited you are about being
and how
done.
long I've been in school.
Yeah, how long?
I think I'm in like a 23rd grade.
Yeah.
I grew up in South Florida, just outside of Coral Springs, and I went to college and dental school at University of Florida. So go Gators, double Gator, triple Gator.
Triple.
Yeah.
I'm triple. What you're double.
Double. And right now I'm finishing up my perio residency at Nova Southeastern. So happy to be in Florida all this time. I met really great people along the way and going right from residency to working in private practice. So I'm really excited for that.
So for those that don't know, Nova Southeastern is in Fort Lauderdale, so right down the street. And we met you through a guy that used to run through the guy that would help run my program, the assistant director, right?
Yep. Dr.
Deuces.
Mm-hmm.
And so tell us about what motivated you to go into dentistry. Why did you become a periodontist? Sort of what's your background? Where did you grow up?
Yeah. So I was lucky to have a household that showed me what dentistry was early on. So my father, he's a periodontist working in Hollywood, Florida towards the tail end of his career. And what I saw was that as someone that's, a periodontist quarterback in the discipline, you're so fundamental in setting strategic treatment plans for patients and kind of, being along the whole entire, road for these patients. You're not just a prescription provider. You're here to maintain people's health, get them out of periodontal disease, and really help either replace teeth or keep teeth in people's mouths for a long time. So I got to see the relationships that my dad had with his patients, and being a kid going to the office and just kind of feeling that good vibe of being in the dental chair. And I went to college. I was interested in the sciences. A little funny fact about me, I was a organic chemistry TA for a while, and that was like my favorite class. So just kind of fell in love with that angle of science. And I wanted to be in a profession where I can always be with people, work with my hands, and just be able to, talk and just understand people and always have that platform. And I'm always, outside doing things. I'm really into basketball and tennis, and just wanted to be, kind of in a job where I can be social and just get to know people and build those relationships.
And that's probably one of the most exciting things, I think, as we've had him come through the office, is the interaction has been pretty comfortable and positive, wouldn't you say?
Yeah, definitely. I would say and I was just telling Dr. Hauer this 5 minutes before we started the podcast, but as soon as he leaves, Dr. Dan is always talking about, he's great, I love him. And I mean, we have a really cool, fun team, and, it's a great fit. So
It's hard to find the right vibe.
Totally,
And
yeah.
I would tout that one of our best skills, in addition to doing full arch, is probably building a team and forming the team around whatever nucleus is there, right? So we have the different offices. We have the Tampa, we have the Boca periodontist office, and then we have our own baby, if you will,
Yeah.
and then the lab, etc. But we have a lot of different microcosms, and they all require sort of a different vibe and energy, and Blake fits in really well with ours, I think. So that's been really fun.
And something that I've really liked is coming from residency to starting to shadow within Done in One, just seeing, how they've evolved to the technology they have and what they're using. I'm used to doing, the most basic to the most sophisticated protocols, because in residency, you learn it all. And to see kind of the pinnacle of what, we have to offer the patients with all the technology is really, really exciting. And I can't wait to use it.
Yeah, so going back, tell us, so I didn't grow up in a dental household, you didn't grow up in a dental household. What is it like growing up with a dad that's a periodontist?
So everyone thinks that you grow up and the expectation is to be a dentist. That's what you're going to do. That's the destiny. It was probably the opposite. Kind of circling back to college at University of Florida, I started off as a general business major and I eventually shifted that to be a minor, but I wasn't really sure what I wanted to do, and there wasn't any pressure. I think that anyone that goes into dentistry, you can't just do it because you want to have a good living. It's a lot of hard work, time, and commitment to your patients. But I think it's a privilege to see, what dentistry is from the background and, what happens in the office and out of the office. And that's what motivated me, really.
Yeah. When you, let's say on steak night, did you guys have like really sharp utensils and really like perfect knives? And if they were dull, did your dad throw a temper tantrum?
Yeah, a couple of things there. So unfortunately, my mom is not a dentist. Well, it's okay. And my brother's also a periodontist. So we're at dinner tables, and as I evolved to be, I guess later in my, dental career, finishing school, there was a lot of dental conversations, and my poor mom has to listen to them all. But hey, maybe she's getting a little better education now, and she could work in an office if she wanted to.
I'm sure she's proud.
Yeah, and adding to the steak knives, I don't think any of our dogs at home are using a scaler at least a couple times a month. So we make sure to sharpen them as much as we can.
Yeah, definitely. No. So as we've gone through this, you're coming into the end of your education portion, but it's really not ending, because now, as we've talked about, part of your whole journey has been kind of figuring out what you want to do. And this is true, for myself and everybody. So you figure out what you want to do, and then you kind of head in that direction, which would be dental school, and then you really tailor it in the residency, right? And so, like I'm telling you, or I've been telling you, what's kind of exciting for me is I get to be the last one that sort of polishes everything off, and so kind of get to be sort of the last one that sort of finishes creating. And of course, we talk about you're practicing dentistry and it's a lifelong thing and you're never perfect at it. And that's totally true. You're always polishing your skills, but more or less you're kind of coming into that last little phase. And so being the person that gets to be responsible for that or kind of push you in that like little finishing touches kind of section is going to be really fun and exciting. And we've already kind of started with getting things going. Of course there's going to be the next year or 2 or 5, it will be constantly pushing the limits and polishing things up. But I'm really excited about having sort of that sort of relationship, kind of tag teaming things back and forth, but also getting you trained and sort of established in sort of the way we do things.
Yeah, I think the goal, we hold the same goal, and I totally agree that anyone that's in the field, you have to continue learning all the time. Everything changes with technology, with new techniques, and something that I'm doing now is, becoming a diplomat for the American Board of Perio like you are, and studying for those exams, continuing to learn. It's so important, and I think joining the practice is going to be a great synergy as, I'm at the height of my career where I want to learn. Dan wants to do a lot of teaching, so we're kind of entering at amazing time points to be mutually beneficial.
It took a long time,
Yeah, I think patients really trust Dr. Dan, and I know that they know anybody that you bring in, especially, now as a surgeon, I know that they'll trust Dr. Hauer. Obviously, when they meet him, they'll love him, but just by you teaching him and bringing them in, it'll be a good fit.
For sure.
They know.
I think the number one thing I'm looking forward to, not that I'm ungrateful for it, but I am looking forward to when the reviews don't mention my name at all. Because what happens is that parlays into getting into the way of when you start to have, let's say, an assistant, their name constantly pops up, then the public or the patient will initially look at that and say, oh, well, they put me with somebody that's not all over the reviews. They put me with the second-rate person. And that's not true. They wouldn't be inside the confines of Dun & One if they weren't top rate. Yeah. It's just people have a longer established time and the names show up. So I'm excited to see when that starts to pop up. Yeah. That will take less pressure off you're giving me to the second-rate guy. And that won't be the case, right? When the minute we have Dr. Hauer here putting in putting his fingers in the mouth and start doing or rolling his sleeves, if you will, is the moment that I trust him and don't worry about it. And, it's the same as if I do it kind of thing.
Yeah. Honestly, I think even the minute that you start to do consults, patients will, I think that's where, we always say that's where it all starts usually. So now they see your name in the reviews and, but I think moving forward, just you doing consults, meeting patients, it'll be a quick click for them to trust. And
interestingly enough, so we randomly ran into a situation where last week I went home to Michigan, where I'm originally from, and just long story short, ended up with the Memorial Day weekend. Today was my first day back in essentially a week, right? Mm-hmm. And first day doing surgery. Yesterday we were in the office. Yeah. And yesterday I had to do some consults. Today I had to do some surgeries. And interestingly, I'm just thinking of this now, I don't know if there's a period of time where I would feel rusty doing this surgery. Like it did feel a little bit foreign because it wasn't, day in, it's been a little while. But I don't think I can really get too much rust there. Where you constantly have to be in practice and doing something is the consults. Agreed. Yesterday, absolutely felt like a total fish out of the water. Yeah. And it was funny because I was stumbling over because I kind of have a pattern, and the pattern comes from dialing in the message that we want to send to the patients, not necessarily from a salesy way, but it's sort of just the important key points. I have to hit every single one of those points so that we know that our patient is educated and ready for what they're about to come down for. Yeah.
I was just thinking, Dr. Hauer, how did you always want to do full arch, or how did that come about?
Yeah, I think that with perio, you have a deep appreciation, of course, for maintaining teeth and doing anything to build a foundation, whether it's GBR.
This is a safe space. You don't have to say that.
No.
I'm just playing. Yeah. I'm just playing.
But
I'm just playing.
You get that background of all these techniques, and then you have patients that come in where maybe they don't qualify for those techniques. Maybe they want something that's faster, or maybe they're not good candidates for that type of treatment. And I think that my angle is that I want to be able to provide all that expertise. And I think that full arch really was interesting to me because there's just a big need for it with aging populations, patients that wear dentures, and people that want to just change their lives and be able to function in a fixed manner with their tooth replacement. Being in Nova, I had a really nice chance to do a good amount of cases together, and also being in different offices and working on protocols and shadowing. But I would just say being able to give people that chance to smile again and function is just motivating for me, and being on both ends of it, the surgical side and the prosthetic side.
Yeah, what you're going to find is you're so intimately involved in seeing the results. It's something that you don't find when you're practicing as a normal periodontist, So typically you may see a patient here and there that had the teeth done on the bridge for the implants that you did. You might see them in passing. Maybe you see them the next time they need to come in and have a different tooth, but you're not intimately involved in sort of that end-to-end situation. And that's really where a lot of my motivation came from. The sad part for you, I was thinking about this as well earlier, is that the whole industry or this niche has sort of changed, where when it became possible to take a person who had not very good looking teeth, or they were embarrassed about their smile and they were all broken and torn apart, and they could get that full smile back without it being dentures, there was a period of time when I really just first had begun where that was sort of mind-blowing, right? And the wave of appreciation and gratitude and emotions that you would get from that patient right away was awesome. Yeah. But that sort of has faded, just like, Tesla being able to self-drive itself has sort of faded to it's just a feature. The same thing has sort of happened now with full arch, where we don't get that same wave. We don't get that same endorphin rush. So that's a little disappointing as you come into it. You're kind of coming into a time in which, they're nice, but there's 62 things that I don't want, or that I want to change about these. and probably you've even seen a little bit of that change too.
I would. And I was just thinking, like, the good thing, this is a little off topic, but how we do things at Done-in-One, it's not like, you guys do the surgery and the patient has to go to a different office, like you were just saying. The good thing, at least with Done-in-One, is that although you may not be doing the restorative side, let's say Dr. Lax is doing that, still in the same office, still in the same building, you can always pop over. And I know Dr. Dan does that a lot, is checking in the patient, and maybe that's when you'll see that gratification, patients being grateful for that final. But yeah, I would say, going back to what Dr. Dan said, is I do see a shift. And like you said, I think it's online and forums and YouTube videos. I think just patients are seeing so much more that they have an exacted idea of what they want.
Right. And that's a good thing and a bad thing.
Is,
all I'm saying is that you'll kind of miss that sort of wave where you get that like initial rush of endorphins from getting that feedback from that patient immediately. Now, there's other things that are very beneficial, and it's great that we're at a point where it's such an accepted technique and way of doing things that it is a little bit more like, of course it's going to work that way. So there's a lot of stuff that we're going to talk through, and you're going to and there's new things that you get to be a part of that were shortcomings in the old way. There were a lot of frustrations. There's a lot of extra gray hairs on my head that probably won't make it to yours, which is awesome.
We could probably do a whole series on the things that you saw that you had to go through that I won't have to go through. The gray hair series. All the gray hair series.
I honestly like that. I think listeners would like that.
I'll just sit here and listen and say, you don't have to do this or this or this. I went through this.
Absolutely.
But, that's as company grows, team builds. We were just talking about that, I think, all together in the office the other day. Is like, that's the beauty of it. Is like, we've gone through it and you know what to do, what not to do. So.
Yeah, when you see every scenario, you know who to talk to with this and how to talk to. So getting you the reps is going to be fun to see that sort of grow over time.
And I think going to the office so far has been awesome. Just seeing everyone in their role and how clean the protocol is, from the front to you guys, interacting with the patients, from the team picking up the patients, from the airport and helping them out with that, to everyone that's facilitating hygiene, surgery side, prosthetic side. I mean, everyone has a defined role. Everyone works together. I mean, it's a really good operation, and I feel like everyone's happy at the office and always in a good mood, which is really encouraging.
Yeah.
Getting that predictability is what really was able to shift everything. Getting a predictable message from the front, getting a predictable message from the consult, getting a predictable message out into the public with the patients sort of reviewing and on their Facebook page. All of that being a whole system and an ecosystem has been probably the biggest quantum leap that we've ever kind of made, more than any technology help of any sort of thing. Just having a buttoned up package has been amazing.
Yeah, I think it's such a big procedure for patients. It's easy for like one thing, it's big investment, travel, whatever it might be. But I think one thing goes wrong in that like chain of links that patients can get upset very easily. But that's what not to brag on us, but that's what I think we do best, is that we never let there be anything. From start to finish. It's not always. It's humans, and we're people. But I would say for the most part, there's very little mistakes that happen from start to finish. Very few things.
I think one thing to add when we go back to my side with education is what really encouraged me to come here as well. Is that our surgeons, our periodontists, our specialists, and I think maybe Dan can add to that as to why it's important. But for me, that's really important to know that we're on the same page about having a formal education to provide this service for our patients.
Yeah, it's a difficult thing to just wrap up into a couple sentences, but it does make a big difference, right? There are plenty of cases that can be done by a general dentist. And that's not to say that they shouldn't be doing them. It's fine if they do. It's within their scope. The problem is that you're missing a little bit of your education somewhat in the management of complications. So when things do go bad, they can go real bad, and you really need to know how you're going to handle it to prevent them from going really bad, right? So you can get something that goes bad and can go really bad. You want to just keep it at bad, right? And so that can be a big thing. Sort of a lot of the parameters and things that we're thinking about. when you're going through residency, it's not necessarily about what you're learning. To me, it's more about the process of how you think about the problem and how you approach it, and what is the background and how does that relate to the issue at hand. And so keeping all of those things into your flow chart, being able to manage that case from start to finish, is something that is very important to us at Dun & One from a surgeon side. And then obviously we don't want the surgeon doing the whole thing, because there's other things that we don't think about in speaking to teeth that we leave to the general dentist. So they have their place. It's just not for us in surgery.
Yeah.
And, just as an example, there was a clip that I saw the other day on Instagram. I won't say who his name was, but, instead of calling it an incision and reflecting a flap, he I forget what the exact verbiage was, but it grated on my ears. He called it like scraping and pushing or something like that. And that's not what we do. And you're taught there's a very particular set of verbiage you use, because it means when you incise tissue, you're making an exact cut. You don't want ragged edges. You don't want to traumatize that tissue. And just not knowing that is something to delineate scares me for the person that's going to get surgery from this person, because it seems maybe minor and you're splitting hairs, but you need to know that needs to be done with a sharp instrument and have clean margins so that your patient can heal well. This isn't just, you just flip it off and you pull it off of there and you scrape it off of there. No, there's a very particular way of doing things that manages the trauma, etc.
So does Dr. Dan lay a flap or raise a flap?
I lay flaps.
Okay.
That's how I.
That was important.
So let's get into some personal stuff. So you mentioned that basketball, you mentioned tennis. What kind of cars do you like? Where do you want to live? Tell us more about you. Are you live in a studio apartment and travel all over the world guy? Do you have any hobbies of interest, like learning Japanese or drawing or painting, playing the guitar?
I guess we got to go like one category at a time. We can do this for a couple hours, right?
Yeah.
Let's go with traveling. That's a good topic for me right now. So I love to travel, love to see different cultures, try different food, just see it all. I'm actually going to Japan in 2 weeks, so to celebrate a little end of residency trip. So we'll be going to...
Congratulations, by the way.
Thank you.
Well deserved.
Tokyo, Kyoto, Osaka. Then we're going to take a plane to Okinawa, which is like the Hawaii of Japan.
Wow. Yeah.
So really pumped for that. Before I started perio residency...
I'm going to interrupt you for a second. So you've obviously done research, read the guides, all of that stuff. What's the weirdest thing that you're excited to experience or try? Because they say it's like showing up in a different reality, which I can make sense. It makes sense.
I feel.
So what's the craziest thing you want to see or eat or experience that you've sort of researched?
That's a tough one. I would say I'm open to just trying like random street food. Like I know that sometimes in like Japanese countries or I guess Asian countries, there's just like random stuff like, hey, eat the scorpion or, crazy raw fish, tuna, whatever it is. I think it's part of the experience. Probably bring some Imodium, but
I was gonna say prepare yourself.
I think trying all the foods is going to be awesome. One thing I researched that I really want to do is Japan, and I believe it's outside of Tokyo, is like the tuna capital of the world. And I love sushi and I eat tuna, and that's where they fly in a lot of their products to the restaurants, and they have this crazy market where apparently they sell tunas that are worth like millions of dollars. So want to check that out, and it's going to be a great trip.
That'd
and then
be awesome.
I guess adding from before I started the residency, I traveled for 2 weeks to Thailand, had an amazing time there, and just being immersed in a different culture. It's also really cheap there, so you live like a king when you go to these countries. But just being active every day, waking up every day early, getting your steps in, seeing some of the cool nature. Of course, experiencing the cuisine, going to temples, and definitely, going in the water, whether it's boating or any of those things. But so I've been to some spots in Europe, the Caribbean, Mexico, Asia. So traveling is fun. Definitely will be harder once I start, getting acclimated to working full time. But I think it's important to make time for myself when we have time to do that, and really want to be able to travel the rest of my life. That's important. You talked about guitar. I played guitar up to like middle school, and then I kind of stopped. Once in a while, I'll go back on it, and I guess my favorite band to play is probably the Chili Peppers.
Okay.
Probably you'll hear me playing Californication 1,000 times. Yeah. It's the only song I'm actually good at. But music is great. Love going to concerts, traveling to see good bands. That's always fun. Enjoying that. Let's see. We wanted to hit some travel, some music. What else? What else did you want to hit?
I asked you what your favorite car brand is.
Yeah.
So,
are you a car guy? Are you a truck guy? Do you not care?
I'm not a truck guy. I'm actually a Scrubs guy when it comes to a tire. And Dan, we've been talking about this.
You try to push your point. It's not going to happen, pal.
He's a polo and pants guy. So he pushed his point and got me 5 polos. So I'll have to buy some pants.
Is this like a topic in like in school that you have to
it's just...
No, I just keep bringing it up. I don't know why.
You go one of 2 ways when you graduate.
Yeah. But car-wise, I drive an Audi. I lease it. I like it. I don't think I'm a huge car guy.
Okay.
At home, I have a 2-year-old labradoodle. She's like 50 pounds. Shout out Peaches. So I think my next car a little bit bigger. Just something to get around with her. We take the dog, me and my girlfriend Beth, to the beach, and Beth and Beth.
Yeah, interestingly enough, both significant others are Beth, which is crazy.
My husband's name is not Beth. So
okay, that was my next question.
I can't contribute to that. But
it does start with a B.
It does start with a B. So the 2 Beth scenario was a cool find for sure.
Very funny.
But yeah, not a huge car guy. Maybe that will come, and yeah.
But maybe not. You'll probably save yourself a lot of money not being a car guy.
Yeah, maybe I'll just Uber everywhere.
Yeah, that's fine.
Not a bad idea.
It's fine too.
Could work.
We might wonder about your criminal past. We actually had a guy who came in, and he was late, and
oh my gosh,
his girlfriend had to drop him off, which is why he was late. And so we legitimately did a full background check on him just to see if he had like a checkered past, if there was a reason why he wasn't driving his own car there, because it seemed a little strange to show up on the first time to come through an office without a driver's license
Hope you're not listening out there.
To this unnamed individial. I wasn't part of the story.
We're not. We're judgment free.
Nobody is safe from stories. We just won't say names.
That's true.
And you also asked where I live, so I don't live in a shack or a hut or whatever question you had.
No, I said studio. Are you a studio appointment?
I'm in an apartment. I live in East Fort Lauderdale, which I love. I'm really passionate about Fort Lauderdale. Just being able to walk to places, going to the beach. Like I said before, just walking to the tennis courts, basketball courts, all that good stuff. May stop playing basketball soon because I do have to keep my hands healthy.
Yeah. I didn't even think of it. That's a
don't
good
jam
point.
those fingers.
But then we have a woodworker over here, so I don't know. Maybe we're both bad.
The old classic.
Can't do full arches without fingers, I guess.
Yeah. Well, that's where you come in. You'll be taking it over for me.
So I guess when I'm here, Dan will exponentially increase his amount of woodworking.
The risks will increase.
Yeah.
The risk is okay.
The contrast we have here is we have a tennis and Japan travel guy, and we got a golf. And I'm taking an exotic trip this summer down to Key Largo.
I was like, where are you going? I feel like we would have discussed this.
All the way down to the Keys,
Honestly,
which is
risky.
Very far outside my bubble.
So the bottom line is that I'll only see Dan in the office because he won't be on the tennis court and he won't be in Japan.
Yeah, exactly. So, well, I appreciate you coming in, Blake. This has been good to get to know you, for patience of your future and patience of the present, sort of an introduction. We long time ago, I did a podcast with a good friend of mine, Craig Spodak, and his partner, and it was about full arch. And to this day, I swear to you, to this day, they still come in and say, I listened to your podcast, like a new patient. So this will be something that you will, I won't say haunt you, but this will be something that will go on for a long time to sort of let people know who you are and what you're about. And so, this won't be the last time we have him on, but it'll be a good sort of introduction and sort of, it's good for people to sort of know more than just that you like teeth, and so talking about going to Japan and such, that gives a good background, makes you human. So
I think patients get really nervous, like the thought of a doctor, dentist, whatever, makes a lot of patients very anxious, and maybe bad past history. But again, maybe I'm being biased, but we have like the coolest, nicest doctors, and every patient knows that, but adding you to the team is a perfect fit. So I know they'll be really, really excited.
Yeah, I appreciate it. I think that as we evolve together, there'll be a lot more content to provide to our community, and also just more episodes. Maybe we'll talk about some of the things we do in the office, protocols. I mean, I know we have a lot of episodes planned, so I'm looking forward to it. I think it was just great to introduce myself to everybody, and we'll take it from there.
Yeah, real quick, I've forgotten, what does Beth do?
So Beth is a consultant. She works with Deloitte, like a large company. Lucky enough, she works from home, which is really great just for, her. A little bit about our story, I guess. We have some time, right?
Yeah.
So we met at University of Florida, and then she was living in D.C. and New York City. So she was able to take her job to Fort Lauderdale, work remote. So it's been awesome for us. And she's really enjoying her job, and everything's good.
DC, then, and how did you guys meet again?
Funny enough, we met on Hinge at University of Florida. We both were in relationships, both ended them, went on Hinge. Apparently, it was both of our first dates on Hinge.
Okay.
Who knows who's being truthful or not? I can't say.
I'm so old, I don't even know what Hinge is.
Yeah, I guess we can take a whole new angle on dating apps now on this podcast.
He's talking about a door. He met his girlfriend at the door.
Yeah, shout out Hinge, I guess, if you guys want to collaborate.
Yeah,
this is a real story.
Well, now now that this will be posted to the internet and forever on, you have to stay with Beth forever.
Yeah, Beth, you don't have to worry about this if you listen. Done in One does like Beth's.
Yes. Yeah, we are Beth people. All right, well, I appreciate you coming in, and Lilia, thanks for coming in and introducing our new talent.
Yeah, we're excited.
Out with the old and in with the new.
Goodbye.
See you later.
He's not very old. He's lying.
No, but we appreciate you, and we appreciate you, everybody out there listening, and look forward to another episode and another follow, like, subscribe. Appreciate it.
Thanks.